Operation Guide for HA280 Disposable Hemoperfusion Cartridge. Operating environment requirements: clean, tidy, and spacious. Upon entering the clean area, any operator shall wear work clothes and shoes. Prior to operation, the 7-step hand washing shall be followed. And a working cap and mask shall be worn. Materials to be used: JF8008 Hemoperfusion machine. HA280 Disposable Hemoperfusion Cartridge. Disposable extracorporeal circulation tubes. Double lumen Finis catheter. Sterile towel. 4 common heparin injections or 2 common heparin injections plus 1 low molecular heparin injection. 5% glucose. 500 ml optional. Normal saline 3500 ml. Dexamethasone 10 mg. Disinfectant hemostatic forceps tourniquet. Clean gloves. Emptying cylinder. Inspection items. Check the model and specification of various articles. If the package is intact and their expiry date and the patient's name. Preparation of pre-rinsed liquid. Use the 500 ml of 5% glucose directly as the pre-rinsed liquid. Prepare 2500 ml of low concentration heparinized saline, 15 to 20 mg heparin, 500 ml of saline. Prepare 500 ml of high-concentration heparinized saline with 100 mg of heparin. Prepare normal saline 500 ml without heparin. Prepare normal saline 500 ml without heparin. Power on self-test of hemoperfusion machine. Check whether the electric circuit of the machine is normally connected or loose. Turn on the main power switch of the machine. Run the power on self-test as required. Adjust the venous and arterial monitoring values in the hemoperfusion machine to a reasonable interval. Installation of HA280 disposable hemoperfusion cartridge and tubes. Take out the arterial tube. Insert the needle at the arterial end of the tube into the pre-rinsed liquid bag and fill the arterial tube with the pre-rinsed liquid by gravity. Take out HA280 disposable hemoperfusion cartridge. Unscrew its arterial end with a dedicated wrench. Pay attention to the blood flow direction and connect the arterial tube to that end. Unscrew the venous end of the cartridge with the dedicated wrench and connect it with the venous tube. Install the arterial tube on the hemoperfusion machine. Install the venous tube on the machine. Connect the end of its venous side to the waste liquid bag. Notes: 1. Make connection following the blood flow direction and put it in place without repetition. 2. Connect all connectors in sequence of operation to avoid prolonged exposure. Pre-rinse. Pre-rinse the hemoperfusion cartridge and tubes from below upward with 500 ml of 5% glucose. For optional use, and 2500 ml of saline containing heparin of 10 to 15 mg per 500 ml at a rate of 100 ml per minute. During pre-rinsing, pat the cartridge gently until air is drained completely. Pre-rinse the cartridge by 500 ml of saline with 100 mg of heparin at a flow rate no more than 500 ml per minute in order to drain air off tubes and the cartridge. The cartridge should be fully heparinized. Optional operation: pre-rinse the cartridge and tubes by 500 ml of saline with 100 mg of heparin and stop pumping when 90% of pre-rinsed liquid gets into tubes. Then remain the pre-rinsed liquid inside tubes for 20 minutes. Finally, rinse the extracorporeal circulation system with 500 ml of normal saline without heparin. And fix the blood circuit to prepare for drawing the blood to the machine after the normal saline containing high concentration heparin is drained. Warm tip: inject intravenously 5 to 10 mg of desamosethone 10 minutes before running the machine to prevent allergy and other adverse effects in the patient during treatment. Anticoagulation. Systemic heparinization is usually adopted. The initial dosage is 0.5 mg to 1 mg per kilogram. Deliver all the heparin via intravenous injection 10 minutes before the immunoadsorption therapy. Add 10 to 20 mg of heparin per hour during treatment or low molecular weight heparin 60 to 80 IU per kilogram without addition. Notes: the dose of heparin should be determined considering individual differences. Generally, the clotting time of extracorporeal circulation should be 45 to 60 minutes. In case of hemorrhagic tendency, neutralize heparin with a suitable amount of protamine at the end of treatment. Notes: usually prepare 50 mg of protamine. Dilute with the protamine half the amount of heparin in the patient normal saline and deliver it intravenously, and continue to neutralize heparin with protamine of the same dose if bleeding remains. Treatment procedure. Perform deep vein catheterization with a double-lumen venous catheter to establish an extracorporeal blood circuit. From immunoadsorption therapy with HA280, the blood should be drawn at 100 to 150 ml per minute, and the rate should be adjusted to 200 and 250 ml per minute as soon as the patient's condition is stable. During treatment, remind the operator of measurement of blood pressure every half an hour and observe the extracorporeal circulation to prevent coagulation. Notes: check the activated partial thromboplastin time (APTT) and prothrombin time (PT) and adjust the quantity of heparin accordingly within 15 minutes after the machine starts if available. Blood return procedure. After 2 to 2.5 hours of immunoadsorption therapy, the blood in the extracorporeal circulation system shall be sent back to the patient's body to terminate the treatment. Hang 2 bottles of a normal saline upside down beside the bed for use. Adjust the rate of blood pump to 100 ml per minute. Stop the machine and clip the tube. Clip the arterial tube of the double-lumen catheter needle. Quickly unscrew the connector between the arterial tubes of the double-lumen catheter needle and the blood circuit. Connect the needle to the arterial tube connector of the blood circuit and insert it into normal saline. Open the arterial tube and let normal saline enter the blood circuit tube. switch on the machine, drive the blood in the arterial tube and a cartridge back to the patient's body by pump and by normal saline. After the color in a venous tube is light, stop the blood pump and click the tube. The whole process takes about 3 to 5 minutes. Notes: try to minimize the amount of normal saline entering the body. Post-operative procedure. When using the double-lumen venous catheter, sterilize each of the orifices of the arterial and venous tubes twice with cotton swab with anti-iodine after clipping the double-lumen venous catheter. Inject 10 ml of normal saline into each of the 2 lumina. Measure heparin according to the volume of the arterial and venous lumina of the catheter and inject it into those lumina in impulse mode. Close the tip and tighten the sterile heparin cap. Wrap the arterial and venous ends of the catheter with sterile gauze or a clean cloth and fix the catheter properly. Notes: for using heparin to seal the catheter, close the clip first and then stop injection to maintain positive pressure in the lumina and prevent formation of clot due to backflow of the blood when injecting heparin in impulse mode.